London. Dr. Mudasir will be talking on COVID-19 and mental health global perspective. Dr. Mudasir, please.
Hello everybody. Thanks for having me today. I'm glad to be invited, and thank you all for joining. As you see, my subject of the talk is a global perspective. I think it's hard to fit in 15 minutes, but I will try my best. So I don't have anything to disclose. No conflicts of interest here. General overview. So I will try to speak briefly about the effect of pandemic on the mental health of general population, then a little bit about how it affected the frontline health workers, and also its effects when people have acute COVID infection, and what are the long-term neuropsychiatric consequences of the pandemic. So I think we all have seen, this is one of the newspapers here, not the famous one. Sounds like panic news, 10 million people are facing mental health crises. I think we see similar news from all over the world. And there's a lot of talk that most of us are probably unwell now because of pandemic, and there's lots of mental health problems going to crop up, or they have already done. Looking at the data, I think it's still too soon to see what is happening. It's hard to quantify, and every country, there are thousands of papers have come out, and I think it's hard to actually guess how the numbers are doing. There was early last year, there was a survey here of Royal College of Psychiatrists, which I'm a member of. So I think most psychiatrists thought that there was like almost 43% increase in urgent emergency cases. And then some were predicting there would be a tsunami of the cases. Did it really happen? This was recently in Nature, which is well respected. So you can clearly see comparison between 2019 and 2020. Just anxiety is kind of more so in the US, 42% compared to 11% in 2019, and I think UK doing a little bit better there. This is one of the independent sector charities here who wrote a long report. So they predicted there would be like 10 million people, in nutshell, additional people who will need help from mental health services because of the pandemic, due to generally anxiety, depression, and other problems. This is one of the largest household surveys which has been happening from many years and decades now. UK longitudinal household survey. So they surveyed around 50,000 people and using GHQ scores. So if you see these cohorts, this is the current cohort, 2019, and this is from 2014. You can clearly see the shift in all age groups. This 16 to 24, 25 to 34 of mental distress. Clearly, all age groups are affected almost equally with such kind of stress. And these are the individual scores around GHQ. I think the worst ones, even the sleep, difficulties concentrating on problems, confidence, general happiness. So everything seems to be affected as per this survey. And there was another survey from the Office of National Statistics last year, which suggested around 69% people have some kind of worry, and more than 50% feel either anxious and some feel bored. And I think if you look up the UCL study, which is online, and I think when I picked it up, it was a while ago. Again, majority kind of referring to anxiety and depression in relation to various problems, usually loss of household income and other issues. This is a quite interesting website if you are interested to have a look at. And this is from CDC in US, who surveyed around 5,000 people, and at least kind of 40% responded with something: depression, anxiety, PTSD, substance misuse in last year, and suicide around 10%, which is fairly significant. What are the potential reasons? I think I don't have to tell you. I think you all know this, that probably social isolation, change in routine, job losses, boredom, conflicts in families, and there's lots of reports of domestic violence. Then some people resorted to drugs and alcohol. A lot of news coming through, which is again happening at the minute, did create a state where people became more anxious, are not able to sleep, can feel more depressed, things like that. And if you look through the data, I think the general sort of reports in general population are usually mostly anxieties on one, insomnia, depression, and if somebody has already had a problem, the symptoms would be worse. Many people have relapsed. I think we have evidence of new cases of mania, psychosis, and if you see case reports, I published one case report recently around that, and increase in drug and alcohol misuse. So I'm going to go through few of the recent kind of hardcore data, mostly meta-analysis. I have to be honest, I know most of my friends have published on this from Kashmir, from other places, from here. I have done some work, but I'm not using that. The reason being, there are so much publications around COVID from everywhere, that in thousands and hundreds of thousands, and I think it's hard to sort of. So I have actually tried to sort of look at the major meta-analysis which have been published most recently, I suppose, in terms of some of these symptoms and disorders which I already referred to. So if we look at anxiety disorders, this recent meta-analysis of 43 studies around the world. So they found that anxiety disorders were 3 times more common than previously. Usual prevalence is around 7%, and usually the anxiety is worse initially at the outbreak, which I think we should all know when the pandemic started. We were all more anxious and more worried, more in females, more in younger people. Not sure how married people get more anxious there, and it's probably arguing too much. Social isolation, unemployment, financial hardships, and you name it. So those were some of the factors which, so essentially the message is that anxiety is the most common kind of difficulty which has kind of cropped up since pandemic. Looking at depression, this is another meta-analysis, 12 studies, prevalence from 8% to around 48%, and pool prevalence was 25%. So this is again 7 times higher than the usual prevalence, which we see pre-pandemic, quite significant there. If we look at PTSD and psychological stress, another meta-analysis, 14 studies, so pool prevalence was around 24%, and psychological stress 24%, which almost 1 in 4 has significant stress because of pandemic. And this is again way beyond the usual prevalence of PTSD, I should say. Who is worse off? So this is another meta-analysis of 50 studies. So they found that clearly the patients who suffered from COVID-19 were the worst off psychologically, then healthcare workers, and then general public. Usually poor sleep, stress, psychological distress, insomnia, PTSD symptoms, anxiety, and depression were the most common in these 50 studies. Children, briefly, I think this another meta-analysis of 15 studies, around 23,000 children in this, commonly anxiety, depression, more than 30%, 40% irritability, challenging behaviors, which is very significant, 79%. I think those with having children would and significant fear of COVID-19 in children. And similarly, in caregivers, parents would be anxiety and depression respectively at 50 and 27%. What happened to perinatal and mothers? I know we have a talk later, so this will be discussed further. 8 studies, around 8,000 women of anxiety and depression. So I think significant anxiety was worse, but depression scores were not as bad in this case. And if we come to health professionals, this was a meta-analysis of 7 studies which compared health professionals to other professions. And again, the anxiety is sort of topping the charts here, 13% with 8.5%, and depression after that. Besides, I think significant people had somatization and insomnia here. This is a significant, let me go back. A significant study, a cohort study, which was published in Lancet Psychiatry of around 62,000 COVID patients. I think they screened 69 million health records, out of which around 62,000 were COVID positive. So out of that, the people who had a psychiatric diagnosis previous year had a higher incidence of COVID-19, and this was seen as an independent risk factor to catch COVID. Simply having a mental disorder is a risk factor for COVID, unrelated to physical health. And in absence of any past psychiatric history, COVID-19 infection was again associated with increased prevalence of psychiatric diagnosis in following 2 weeks to 90 days compared to other infections like influenza, other RTIs, or even surgical problems, fractures. So hazard ratio was again highest for anxiety, insomnia, and dementia here, which is significant. Briefly about when somebody gets infected, I think mainly if you see ITU, you will see delirium, catatonia, psychosis, other neurocognitive or behavioral problems. And this is the data from those who have COVID or who were admitted. 72 studies in this meta-analysis. Most common anxiety at 40%, then insomnia, then anxiety, memory impairment, depression, confusion. And in post-illness stage, again, I think sleep is the major factor many people are talking about. This says 100%, which I'm not actually sure. Traumatic memories, fatigue, memory impairment, and delirium in ITU in 65% and 25% who subsequently died out of this lot. Quite significant there. So what are the long-term consequences? This is again one big study in Lancet, around 80 million health records where this is the UK one. Primary cohort who had COVID were compared again with other respiratory tract infections and influenza. Out of this significant number of 230,000 cases of patients who had COVID. So I think this is worrying. This says around 1/3 of those people who had COVID would develop some kind of neurological or psychological disorder in next 6 months. And more so people who are in ITU, they will have a first diagnosis around 25%, which is very significant and worrying. But this is a very busy slide, sorry for this. Just wanted to sort of make sure. So if you look at all these diagnoses from intracranial hemorrhage to Guillain-Barré syndrome to dementia to psychosis, I just want to make a brief comment about vaccines here, because most people think that if they take a vaccine, they will have a very serious side effect. And this is what can happen if you get COVID. All these disorders are very much far worse than having some of the side effects of vaccines, even a clotting disorder, I assume. So is the news all bad? Probably not. So this study, which is you may have heard of this Psychological Research Consortium, which is ongoing from UK and many other countries, Italy, Middle East, India. I think Dr. Majid is part of this. So they looked up some of the data in waves in March, and then in April 2020, and in July. The conclusion is that the psychological response is heterogeneous. Everybody doesn't respond same way. And overall prevalence of anxiety, depression has remained stable. So I think they are arguing that probably whatever the studies are saying is probably not that correct. And usually in the wave 23, there was less PTSD. I think they are basing it on that people got used to it, they accepted it, and they're supporting easier. And they have come up with this idea of a resilient class here. Which is a good news. So although there was an increase, but they think that with ongoing pandemic, the numbers are not actually increasing. They remain stable, or they're actually dropping. So I think I will stop there. This is my email address and contact. These are here some of the references. Thank you very much for listening to me. We'll catch up again in the Q&A session.